Okay, everybody, welcome to Module 2 for our South Carolina training. Hey there, Dr. Will here. So let me go over a couple of things, definitions that we use in neurofeedback. One of the first ones is cycles per second, CPS. Basically what that means is there is a line on the oscilloscope and we go from the baseline to the top to the bottom like that, and that's one cycle. And the top of the cycle is called the amplitude, that's the highest part, and the bottom is called the trough. Not necessarily that important for you to remember that, but cycles per second is important. What we measure a wave by or a neuron by is what kind of electrical output they put out that we look at on the oscilloscope, and how many of these ups and downs, okay, these amplitudes we get in 1 second. Now, we have fast waves. The fast waves are called beta waves, all right? There are faster waves than that, and we'll get into that at some other time. The beta waves are your concentration waves, and they have 3 subdivisions or 3 parts. And we'll go over those in just a moment. But these are your awake waves. Awake and concentration. These, what a wave again represents, as I explained in the first module, a wave represents a cycle per second, all right, that you're looking at on an oscilloscope. And essentially it's a representation of a neuron, of a brain neuron. So the brain neurons that make these particular cycles per second are called beta, all right? And there's 3 types of beta that we'll talk about. And these are the fast waves, all right, which is an important category for fast waves. Now, there are different types of slow waves. Under beta, we have alpha, all right? And then we have theta, and then we have delta. All right. Now, delta waves are the slowest waves. Then theta, a little faster, alpha, a little faster. But all of these are, and we'll explain how exactly that works in a moment, but all of these are called your slow waves. And these are the different brain neurons that we treat and we aim to balance in neurofeedback programs. In this particular neurofeedback program, Brain Core, all the dysfunction happens when the fast waves go out of sync with the slow waves. Now, what is that synchronicity? I was explaining in the first module that it should be 3 to 1, a ratio of 3 to 1 slow wave to fast wave. We call this something in neurofeedback. We call this activation, and that's an important thing to remember as you are a technician. The activation, because the activation number, which I will explain to you later, tells you how good the session is going, all right? So that's this part of it. Now let's take a closer look